everyone, I welcome you all to this channel and I welcome you to this 11 episodes of our video, which is Target Nursing Officer exam. Question number 1. Numbers of deaths under the age of 5 years per 1000 live birth is option A, IMR, which is infant mortality rate, B, NMR, which is neonatal mortality rate, option C, U5MR, which is under 5 mortality rate, option D, ENMR, which is early neonatal mortality rate. Correct option here is option C, which is U5MR, that is under 5 mortality rate. And currently this rate is approximately 35 per 1000 live birth in India. Question number 2. Number of deaths under the age of 1 year per 1000 live birth is option A, U5MR, option B, IMR, option C, NMR, option D, ENMR. Correct option here is option B, which is infant mortality rate. Infant mortality rate. And currently it is approximately 28 per 1000 live birth in India. Question number 3. Number of deaths under the age of 28 days per 1000 live births is option A, ENMR, option B, U5MR, option C, IMR, option D, NMR. Correct option here is option D, which is neonatal mortality rate. Neonatal mortality rate, the rate is currently approximately 22 per 1000 live birth in India. Question number 4. Number of deaths under the age of 7 days per live birth is option A, under 5 or U5MR, option B, IMR, option C, NMR, option D, ENMR. Correct option here is option D, which is ENMR, that is early neonatal mortality rate. So neonatal or neonate is divided into early and late. Early neonate is which is less than 7 days, and the late neonate is 7 days to 28 days. So the current rate of this early neonatal mortality rate is around 20 per 1000 live birth in India, and this number may change also in few days or few months to come, depend on the data or information collected. Question number 5. In India, mortality of under 5 children is due to option A, pneumonia, diarrhea, bird asphyxia, option B, pneumonia, measles, vomiting, option C, bird asphyxia, false jaundice, option D, diarrhea, false kidney disease. In India, there are eight most common causes of mortality in 8 common causes of mortality in under 5 years children. Number 1 is pneumonia, which is comprised approximately 24%. Number 2, complication of prematurity, which is approximately 18%. The complication is due to like the baby born prematurely So whatever the complication happens, that leads to the death of the baby. Number 3, diarrhea. Diarrhea, which is approximately 11%. Number 4, birth asphyxia, which is approximately 10%. Number 5 is neonatal sepsis, that is approximately 8%. Number 6 is congenital anomalies, approximately 4%. And number 7 is measles, 3%. Number 8 is the injuries or falls, which is approximately 3%. So these are the 8 common causes of death in under 5. That is pneumonia, complication of prematurity, diarrhea, birth asphyxia, neonatal sepsis, congenital anomalies, measles, injuries. So here we find option A, which consists all 3, which that is pneumonia, diarrhea, and birth asphyxia. So the correct option here is option A. Question number 6. ASHA stands for option A, Associated Social Health Activists. Option B, Accredited Social Health Activists. Option C, Accredited Society Health Activists. Option D, Associated Society Health Activists. This question had come before in nursing exams. So the correct option here is option B, that is Accredited Social Health Activists. And these are the main roles of ASHA. Number 1, mobilizing the pregnant mother for antenatal care. Number 2, accompanying pregnant mother to facility for delivery. Number 3, home care of newborn. Number 4, facilitating immunization. Number 5, promoting complementary feeding. Number 6, primary care in diarrhea and pneumonia. Number 7, giving health education. These are the main roles of ASHA. Question number 7. Weight of the baby become double by option A, 9 months, option B, 6 months, option C, 12 months, option D, 3 months. Here the weight of the baby at birth will be around 3 kg. This is approximately 3 kg. So after birth, during few days, the baby will lose around 10% of birth weight. So after few days, the baby weight will become around 2.7 kg. And then at 10 days of age, the baby will regain the birth weight, that is approximately 3 kg. And then this baby will subsequently gain weight that is around 25 to 30 grams per day for first 3 months of life. And then after that the baby will again gain around 400 grams of weight every month, 400 grams per month for remaining that is from 3 months till 12 months for the remaining 1 year of life. And then the weight become double by 5 to 6 months. I wrote 5 to 6 months because some book wrote 5 months, some book wrote 6 months. And then the weight will become triple by 1 year. The correct option here is option B, which is 6 months. And by the age of at 2 years, the weight of baby will be around 4 times 4 times the birth weight. Suppose the birth weight is 3, so the weight of baby at 2 years will be around 12 kg. 4 times of 3 will be 12 kg. And then at the age of 3 years, the weight is 5 times the birth weight. That is 5 into 3 will be approximately 15 kg. At the age of 5 years, the weight can be calculated by multiplying. At age 5 years, weight is equal to multiplying the birth weight multiplied by 6. That is, the birth weight is 3 kg multiplied by 6 equal to 18 kg. By 5 years, the baby will be around 18 kg. And at the age of 7 years, the weight will be birth weight multiplied by 7. That is 3 into 7 will be 21 kg. And at the age of 10 years, the weight will be calculated by birth weight multiplied by 10. So 3 multiplied by 10 equal to 30 kg. At the age of 10 years, the baby will be around 30 kg. And on average, the child gains about 2 kg per year between the age of 3 to 7 years, and the child gains 3 kg per year between the age of 7 years till the start of puberty. So these are the few things which we have to remember. So in case any question comes on this topic, we can answer the question or we can choose the correct option which is given.